You know that little worry, that nagging feeling sometimes in the back of your mind
Uh-huh.
that maybe something's going on inside silently? That fear. Well, the fear of getting a diagnosis way too late.
Right. It's common anxiety.
That's kind of the space we're diving into today. But what's really compelling, I think, is this potential, this groundbreaking potential to find those things much, much earlier.
Exactly. Forever, medicine's been mostly reactive, right? We step in once the disease is already there.
Mm-hmm.
But imagine a real shift, a big one, towards a future where we can spot the tiniest biological signs of illness. Maybe even years before you'd actually feel anything,
Wow. Years.
potentially.
Yeah.
That's the really transformative promise we're looking at today.
And driving this promise, this incredible force, is artificial intelligence, AI. And we're not talking, sci-fi robots here. This is about actual progress.
Yeah.
How AI is learning to analyze really complex medical data and find those first whispers of diseases, things like cancer, neurodegenerative conditions, heart problems.
All big ones.
Yeah. So our mission for this deep dive is to unpack how AI is doing this, look at the real advancements, and importantly, what it could all mean for your health.
Okay.
We've got a lot of great information here on AI and early detection, so
Okay.
let's jump in.
Sounds good. And I think to really get the scale of AI's impact, it helps to look back first, at how we've traditionally done early detection.
Okay, the established methods.
Right. We've relied for a long time on crucial tools, screening programs mostly, mammograms, pap smears, colonoscopies, blood pressure checks.
Things we all know about, hopefully do.
Exactly. Plus, people paying attention to their own symptoms and regular checkups. And these things have definitely saved lives, no question.
Absolutely. They're the foundation, the bedrock of preventative care. But, and this is the key part, they have limitations, don't they? It's not a perfect system.
That's a really important point. A major limitation is just how much we depend on obvious symptoms.
Things you can actually point to.
Yeah. But so many diseases, especially in those early stages, they progress silently.
Right.
Hidden.
So by the time you notice something is wrong, the disease might already be quite advanced, and that makes treatment much harder. It's like a fire smoldering unseen until it bursts into flames.
That's a great way to put it, a slow burn.
Yeah.
And then there are the screening tests themselves, even the best ones.
Yeah.
Well, they don't exist for every disease, do they?
No, not at all. And even the ones we do have, they have limits on sensitivity.
Right.
Sometimes they miss early signs.
Right.
Or specificity, meaning they can sometimes give false positives.
Which causes a whole lot of anxiety and unnecessary follow-ups.
Exactly. And then you've got issues like access and patient compliance.
Yeah.
People need to actually get screened.
Right. Which involves access to care, awareness, cost, maybe even fear of what they might find.
All of those. Plus, reading many of these tests, like medical images or pathology slides. It takes a lot of time, highly specialized time.
Creates bottlenecks, I imagine.
It can, yeah. And it increases the chance, inevitably, for human error, especially when workloads are high. And just thinking about scaling that up, trying to frequently screen millions of people for lots of different diseases, using just those methods, the challenges seem enormous.
They really are. Logistically, financially.
Yeah.
It just highlights the need for something more sensitive, specific, scalable, proactive.
Which is where AI comes charging in.
Precisely. Artificial intelligence, especially machine learning and deep learning, it's turning out to be this incredibly powerful tool for digging into all the complex medical data we now generate.
Okay.
It can see patterns, find anomalies, things that are often just too subtle, too complex for humans to spot reliably, especially really early on.
Okay, let's break that down. This AI advantage. Medical images seem like a huge area. How is AI actually looking at an X-ray or an MRI differently?
Well, what's really fascinating is how these AI models, especially deep learning ones called convolutional neural networks, how they learn.
Okay.
They're basically shown massive data sets, millions of medical images, X-rays, CTs, MRIs, ultrasounds, retinal scans, even like microscope slides of tissue.
Millions. Wow.
Yeah. And by seeing all these examples, the AI learns to recognize incredibly subtle visual clues that point towards disease. It's like learning by example, but on a colossal scale.
So it's training this super focused, tireless expert to spot the tiniest little thing. Can you give us some concrete examples? Where is this actually working now?
Sure. Cancer detection is a big one. AI is showing amazing potential. For lung cancer, AI can now spot tiny nodules on CT scans, often when they're much more treatable.
That's huge.
This. For breast cancer, AI is getting really good at finding subtle microcalcifications in mammograms, things that are easy to miss. And skin cancer, AI analyzing pictures of moles, helping spot melanoma early.
Yeah.
Often with accuracy that's, well, as good as or even better than experienced doctors.
Better, really?
In some studies, yes. And it's not just about finding them a bit earlier. AI's consistency, its ability to see patterns humans might miss, it could seriously cut down on those interval cancers.
Ah, the ones that pop up between screenings. Always a worry.
Exactly. That's a major challenge right now.
That's incredible. It really is like having an extra set of highly trained eyes on every single scan. Tireless, consistent. And it's not just cancer, right? What about neurological stuff? Alzheimer's, MS?
That's right. AI is making big strides there, too. Analyzing brain MRIs, it can pick up very subtle changes in structure, patterns linked to early Alzheimer's or MS.
So finding it earlier potentially means intervening earlier.
That's the hope. Opening a window for interventions much earlier in the disease, maybe years before the clinical symptoms really show up.
Wow.
And interestingly, even retinal scans, eye scans are proving useful.
The eyes again.
Yeah. AI can analyze the tiny blood vessels in the retina to find early signs of things like Parkinson's or even predict stroke risk, not invasively.
Amazing. The eyes truly are a window to the brain, apparently. And vision itself, we shouldn't forget that.
Definitely not. Ophthalmology is another area where AI is shining, detecting diabetic retinopathy, for example.
A big cause of blindness.
Exactly. AI analyzes retinal images, spots the early signs, allows for timely treatment, prevents vision loss. The speed and consistency are key here, helping specialists manage the workload.
So images are one part, but our bodies, they generate so much other data, right? Down at the molecular level. Genes, proteins. How's AI helping make sense of that?
Right. This is the world of omics, data genomics, codiomics, metabolomics.
Okay, break that down simply for us.
Think of genomics as the cells blueprint your genes. Proteomics studies the workers, the proteins doing the jobs, and metabolomics looks at the byproducts of all that activity, your metabolism.
Got it. Blueprint, workers, byproducts.
AI helps us find tiny clues in this huge amount of molecular information, clues that something might be starting to go wrong. This data is just unimaginably vast and complex for humans to really parse effectively for subtle early signals.
So AI is like a superpowered data detective for our insides. What's it looking for?
Exactly that. It sifts through all this data to find what we call early biomarkers.
Biomarkers, okay.
Subtle patterns, maybe combinations of genes, proteins, or metabolites that act like early warning signs for cancer, heart disease, autoimmune conditions, you name it.
So like finding a tiny piece of evidence.
Kind of. For example, AI might detect specific bits of tumor DNA floating in your blood long before a tumor is big enough to see on a scan. It's like finding a single microscopic breadcrumb that tells you a whole loaf was just baked nearby, but biologically.
That's an incredible way to think about it. And can it go beyond just finding these markers, like understanding my personal risk?
Absolutely. By analyzing your whole genome, AI can help spot genetic predispositions.
So if I'm more likely to get something.
Yes, which allows for a really personalized risk assessment. And then the tailor prevention, create more targeted screening schedules just for you if you're at higher risk. And even better, if AI can pinpoint the specific molecular drivers causing the potential problem in you specifically. Well, that could lead to personalized early interventions, fixing things at the very beginning.
So therapy is designed before you even feel sick.
Potentially, yes. And entirely new preventative therapies.
It really feels like we're shifting towards much more individual, proactive healthcare. And this isn't just confined to the clinic or the lab, is it? What about wearables? My smartwatch.
Ah, yes. Another incredibly exciting area. Think about all the data constantly streaming from smartwatches, fitness trackers, glucose monitors,
Heart rate, steps, sleep.
temperature, blood oxygen, glucose levels. It's a continuous flow of physiological data. And AI algorithms are being developed to analyze these massive streams in real time.
So my watch could actually be learning my body's normal and spotting when things go slightly off.
That's exactly the idea.
Yeah.
AI can spot subtle deviations from your personal baseline that might signal the very, very early start of an illness.
Like what?
Maybe early signs of an infection, even before you feel sick. Or noticing a slight worsening in a chronic condition like heart failure. There's even research looking at changes in how you walk your gait from wearables. that could indicate early neurological problems.
That's mind-blowing. These devices could become personal early warning systems, just running in the background.
Precisely, and when the AI spots a pattern it thinks is concerning, it could trigger an alert.
To me, or my doctor.
Either, or both. Prompting an early check-in or intervention. Imagine getting a notification. Your watch detected an irregular heart rhythm pattern over the last few days. Recommend consulting your physician before it becomes a major event.
Wow.
This kind of continuous personalized monitoring powered by AI, it could really change the game for early detection, bringing it right into our daily lives.
Okay, so we have images, molecules, wearable data, but there's also just tons of information locked up in text, right? Medical records, doctor's notes, research papers.
You're absolutely right. A huge wealth of information is hidden in that unstructured text. Electronic health records, physician notes, pathology reports, all the published research. This is where AI-powered natural language processing, NLP, comes in.
NLP, so AI can actually read and understand all that text. How does that help with early detection?
Essentially, yes. NLP algorithms learn to read and interpret this medical language. They can identify early symptoms, risk factors, even complaints that seem unrelated, but, when put together, might signal a developing disease.
How does it learn that?
Think of it like teaching a computer medical vocabulary and grammar on a massive scale. It learns to spot patterns in how things are described that often correlate with specific conditions.
Can you give an example?
Sure. Imagine an AI reading through thousands of patient records, noticing scattered mentions over years of things like persistent fatigue, occasional joint pain. Individually, maybe not much.
Right, could be anything.
But the AI might see a pattern suggesting, say, an early autoimmune disorder, prompting a closer look much sooner than a human might connect those specific dots across time.
Okay.
It can also scan EHRs to find patients who might have a disease but haven't been diagnosed yet, flagging them for review.
Finding the undiagnosed.
Exactly. And on a bigger scale, NLP can digest millions of research papers way faster than humans, helping identify new knowledge about early markers or risks, speeding up discovery itself.
This all sounds incredibly powerful. It's easy to get swept up in the potential, but is it actually happening? Are we seeing real-world impact now in May 2025?
Oh, absolutely.
Yeah.
The exciting part is this isn't just theory anymore. AI is already making a real difference. Look at cancer detection again.
Okay.
AI is being used in mammography screening right now, acting as a second reader for radiologists.
Helping them out.
Helping detect breast cancers earlier, more accurately, and cutting down on both false alarms and missed cancers.
That's fantastic.
In lung cancer, AI analysis of low-dose CT scans is really boosting the early detection of those small nodules. That's critical for survival rates. We're seeing AI-powered apps, even tools doctors use, that analyze mole pictures for early signs of melanoma, prompting people to see a specialist sooner.
Wow, even on your phone.
Yeah. And for prostate cancer, AI is helping analyze MRI scans and pathology slides for more accurate diagnosis and grading. Getting cancer at stage 1 or 2 instead of 3 or 4, it just changes everything. Dramatically better treatment options, much higher chance of a cure.
Those are really strong examples. What about those slower diseases like Alzheimer's? You mentioned potential earlier.
We're seeing real progress there too. Researchers are using AI to analyze all sorts of data, how people speak, subtle shifts in writing style, eye tracking during tests, brain scans.
All looking for those super early signs.
Exactly. Trying to detect Alzheimer's years before major cognitive decline hits. That early detection creates this crucial window, maybe for interventions to slow things down.
That offers so much hope.
It really does. And similarly for Parkinson's, AI analyzing voice, gait from wearables, tremors, identifying early markers to get people diagnosed and onto supportive therapies sooner. It's quite something. If you have a family history of these things, this must feel significant.
It absolutely does. It feels like AI is giving us a chance to get ahead of these devastating diseases. And it's not just the brain, right? The heart, too.
Definitely. AI algorithms can look at routine ECGs, electrocardiograms, and predict risk of heart attack or stroke with really impressive accuracy.
From standard ECG.
Yes, finding subtle patterns missed by traditional interpretation. And even more surprising, remember the retinal scans?
Yeah.
AI analyzing those eye images has shown it can predict cardiovascular risk factors, even future heart events. A totally non-invasive screening tool.
Incredible.
Finding people at high risk earlier means they can make lifestyle changes, start preventative meds, things that make a real difference.
Right.
And, stepping back slightly, we even saw AI helping spot early signs of infectious disease outbreaks by analyzing news, travel data, allowing faster public health responses.
So the common thread through all of this
Is AI's incredible ability to process huge amounts of diverse data and find these subtle, complex patterns. Patterns that signal disease is starting, often way before a doctor or even the patient themselves would suspect anything's wrong.
It's a fundamental change.
It really is. We're moving from relying on late-stage symptoms to having these tireless, super perceptive AI detectors working at so many levels, visual, molecular, even linguistic. It's changing how we think about health.
This sounds so transformative, doesn't it? It really paints a picture, a much more proactive future for health. So thinking big picture now, what's the main takeaway?
I think the main takeaway is that AI in early detection really is a paradigm shift for healthcare.
A paradigm shift. Okay.
We're moving away from just reacting to sickness
Mm.
towards proactively seeking out the very first signs of trouble.
Yeah.
When diseases are most treatable.
Giving us more control.
Exactly. Giving us the potential to understand our own health better than ever and empowering both us and our doctors with genuinely actionable insights.
It's almost like AI gives us this new sense, the ability to see the unseen inside us.
That's a great way to put it. Imagine a future where routine health monitoring, supercharged by AI, means things like cancer, Alzheimer's, major heart disease. Yeah. They're consistently caught and managed much, much earlier.
Leading to longer, healthier lives.
Exactly. More fulfilling lives for potentially millions of people.
In that future. It doesn't feel like science fiction anymore.
Not at all. The groundwork is being laid right now. It needs ongoing innovation, of course, rigorous science, close collaboration between different fields.
Ethics, too, I imagine. We haven't even touched on the challenges like data privacy, bias.
Oh, absolutely crucial challenges. Data privacy is paramount. We need to make sure algorithms aren't biased, that they work fairly for everyone. They need thorough clinical validation, seamless integration into how doctors work.
And understanding how the AI reaches a conclusion, right? The black box problem.
Yes, explainable AI is vital, and robust regulations are still developing. These are all critical pieces that need careful attention, ethics, transparency, collaboration, but the promise is just immense.
It truly is the promise of genuinely proactive health for everyone. This has been a really fascinating deep dive. It certainly makes you think. Think about your own health, the future of medicine. What are your thoughts on AI playing this role, spotting diseases earlier? It's definitely food for thought as we move towards this proactive future. Thanks for joining us today.